Sreedevi ma'am. Ma'am, you're muted, I guess.
I think everyone is joining back. Everyone is there, right, Shripriya?
Yes, ma'am.
Yeah. So we had a very good time in the small groups, a lot of discussions and lesson plan. I think today everyone was a little more clear, like what are we supposed to do than yesterday. But that happens at every batch, like how much ever video instructions were tried. But still, it's that is okay. First day, but we had a very good discussion yesterday. So we'll start with the group one. Yes, Dr. Anupama, please go ahead.
Yeah, actually, good afternoon, everyone. I just wanted somebody to share my slides, which we had prepared. Probably it was sent by Dr. Madhu.
We are sharing from here.
Yeah.
Yeah, I sent to, please share version 4. Sripriya ma'am, can you?
Sir, I think you have shared version 3 with me, right?
4.
One
Sent
second. 1 second.
after, yeah.
Is it the one we are sharing from here?
I guess not, ma'am, because right now only I got the latest version. I have just sent it to Anu.
Okay. Just give us a moment.
Yes.
Yeah, ma'am.
Okay, please go ahead.
Yeah, good afternoon, everyone. Today our topic was on pain and its dimension. So next slide, please. Yeah, so our teaching plan regarding this is for the first years, the module 1. So we have included both the modules. Wherein actually the pain is featuring, including the physiology actually part. So this is for the first years. So we have divided the topic actually for 1 hour period, wherein we want to conduct the pre-test with the MCQs for 10 minutes and just see there to test their knowledge, followed by brainstorming session, which will last for 10 minutes. Then there will be a YouTube video for 5 minutes, wherein we'll ask them to write reflective writing for 10 minutes. Then we'll have a little theoretical discussion on the physiology of pain, various dimensions of pain. And finally, we'll have a case-based discussion or a case scenario we'll project for 10 minutes, followed by a post-test, which will be similar to the pre-test via MCQs. Next slide, please. Yeah. So the competency that we are testing here is 8.1. It is describe the anatomical correlates and physiological principles of pain, which is there in the ATCOM module. And domain is knows and knows how. Core competency, and it will be a large group teaching as a didactic lecture. Next slide. Yeah, this is a pre-test we'll be conducting with the MCQs. Then we'll do some brainstorming with the students, like how do you understand the pain? As our mentor had given us some ideas, we were just thinking that maybe we hit a hand or anything, and then we say, how did you get the feeling of pain? Like in the sense, how did you radiate? What is the pathway? Was it acute? What are the various types of pain? And what is the difference between acute and chronic? So if it like, you give by example, it the students understand better. Yeah, next slide. Then we'll show a YouTube video and we'll ask them to write some reflective, and then by active participation, do the present about the video. Like what are the aspects of pain that they could perceive from the video. Theoretical discussion then. Yeah, next slide. Yeah, so the learning objectives will be to be able to enlist the different dimensions of pain. Second one, to be able to identify the different dimensions and to understand different types of pain as well. So this will include a part of the physiology also, in addition to different domains of pain. Next slide, please. So we'll just start with the definition of pain and an unpleasant, unsensory, and emotional experience associated with actual. This is 1979. Then we'll go to the next slide. So wherein it was further modified, and we'll say how the definition has further changed and how the various expanded upon by the addition of the 6 keynote. Next slide, please. Yeah, and then we will highlight all the 6 keynotes so that they will know what is the personal experience. Pain and nociception are different phenomena. Pain cannot be inferred solely from activity in sensory neurons alone. Through their life experiences, individuals will learn the concept of pain, and a person's report of an experience as pain should be respected. And although pain usually serves as a adaptive role, it may be adverse effects on function and social and psychological well-being. And verbal description is only one way of several behaviors to express pain. Inability to communicate does not negate the possibility that a human or a non-human animal experiences pain. Yeah. So, yeah, next. Pain is what the patient says hurts. So we have to believe the patient. Next, about his and her pain. Next slide, please. Yeah, so briefly, we'll just highlight the pain pathway. Actually, this we might put it during the example when we can just hit on the hand or, pinch and then say that what is the type of pain, how it is radiated, and then we will show them the pain pathway. Next slide, please. Yeah, and then we'll have a case scenario. Next slide. Wherein a 33-year-old male diagnosed with CA of left mandibular alveolar complex and presented to a plain clinic with severe pain at the left side of face and neck, swelling of the left jaw, and difficulty in swallowing. Next slide, please. So past history, it was revealed that the patient complained of oral ulcers on the left mandibular gingula for 1 year. He was diagnosed with squamous cell CA of the left mandibular alveolus. He underwent the commander surgery and post-operative radiotherapy as well. And he was under regular follow-up with surgical oncologists when he suddenly started complaining of severe pain in the left submandibular area, wherein CT confirmed a fracture of the left mandible. And his pain medication stepped up from WHO ladder 1 to WHO ladder 2. Next slide, please. So he was young, educated, working as an administrative officer in an MNC. He was married, had a 2-year-old son, and was living in a joint family. He had a habit of cigarette smoking, tobacco chewing since 7 to 8 years and was used to consume alcohol occasionally. Next slide, please. So in this, he was worried as to why he had developed cancer, why the pain is so unbearable, why surgery was again advised, why this recurrence of the cancer. He raised concerns about loss of job, worries about family, loss of role and social status. He was angry at the fate because of his sufferings. He was guilty of not being able to take care of his family, especially his wife and 2-year-old son. Many a times he felt helpless and frustrated that he could not bear his pain and was getting dependent on his family at the time when he should have been fulfilling their responsibility. And his family relations were very getting disturbed, and he even got irritated at his 2-year-old child. Next slide. So here we have clearly described what are the various dimensions. So means the students themselves can say which statements actually is apt for which. Physiological, behavioral, sensory, cognitive, affective. Next slide, please. So here we'll just again highlight the physiological pain by the pathway. Next slide. So behavioral based on the facial expression, posture and all, wherein we know how much he is in pain. Next slide. Then the sensory, the area of the pain, the pattern, intensity, referral of the referred pain, and nature of the pain. Then cognitive, his beliefs, attitudes, memories, and meaning attributed to pain. Then regarding various emotional responses that has occurred because of the pain. So it may be either anger, depression, anxiety, fear. So all these actually will be highlighting. And social, yeah, next slide, please. Socio-cultural regarding family, social life, work and home responsibilities, recreation, leisure, environmental factors. Next slide, please. Yeah, so ma'am, as we got a guidance, this is actually a tip of the iceberg. So it's only 10%. So below, as we see, the pain has got numerous components, and we see only the physical pain, but the various other emotional, psychological, and spiritual pain which is attached to this particular is very well highlighted by this case scenario. So we will ask the students to identify the different components of the pain through this case-based discussion. Next slide, please. Then similarly, we'll highlight this slide on the various dimensions of pain, and which we'll go ahead with in detail about it. Next slide, please. So this is how the total pain actually of the patient is not physical pain alone, but the psychological, physical, spiritual, and social, which will overlap each other. Yeah, next slide, please. Yeah, this we have already discussed. Next slide. So then we are going to conduct a post-test, which will be similar to the pre-test by giving the MCQs. So with this, actually, we come to the conclusion. We just summarize at the end regarding the various dimensions of pain and how they have to look into various other. Maybe we'll have to add few more examples to make it more attractive and not being too monotonous a lecture. Yeah, thank you.
Thank you, Dr. Anupama, and everyone in group 1. I'll wait for the other faculty members to and other participants to give their inputs if there are any. Either close you. Dr. Anupama, I think Dr. Sajid is asking how much time is there for this?
It's a 1 hour lecture. That's what we had highlighted in this first slide, teaching slide, 1 hour. It's a large group didactic lecture. So wherein we use all these different methodologies to keep the attention by examples.
Any other participants? Anyone has already taken the session for first time review students? So I was just thinking the scenario that you presented, most of these terms will be too much for a first year students. They may not understand the staging or the CT or anything.
Yeah.
Maybe to keep it a little more simple, which they usually see maybe in their homes or
Actually, ma'am, we had discussed one more with our mentor, ma'am, and she had suggested a simple lower respiratory infection, which later on turns thought to be tubercular, and later on turned out to be lung cancer. So the agony which went through from normal respiratory, so that was very well highlighted by ma'am during our discussion part. So I just thought I'll make a mention of that also. So it's a very simple lower respiratory, they'll understand about it easily.
Yeah, because the students should be able to relate that.
Yeah.
And one more thing that we discussed in the group 5 was, if possible, if they can listen to a real patient, either in a hospice or in your own ward, if patient is willing to come and share, if they are allowed to ask some questions to the patient after taking consent, like what did they feel when they had pain. So they might explain more about their experience as such. So I think that will be something that they can remember, because they can see that it is a real thing. It is not just in the textbook. Because believe the patient, when they say it hurts, it is easy to convey to senior doctors because they might have seen a lot of patients telling about pain and not being considered. Students, they might not have seen, so they need to understand the difference between what is believing and not believing the patient. Just my. Thank you everyone. Group 2.
Good afternoon, everyone. Shreepriya ma'am, can you please share the last slides, the last presentations which I have shared?
Sure. Anup, just share the one which I sent recently. I believe this is the one.
Yes. So the topic for our presentation was principles behind multimodal approach to pain relief. Next slide. So the contents being divided as discussed, as shown in the module. We will first planning for the integration of the basic pain pathophysiology in the physiology class during the first year MBBS when they are being taught about the neurology system in the physiology class. The second is integration of these neurophysiology and pathophysiology with the pain and the pain receptor pathways during their neurology session as well, nervous system class as well, and a brief idea about giving the classification with origin and duration then and there itself. The second component is the self-learning module, where we'll be sharing some flyers and some study materials to for them for their self learning regarding the mechanism of various kinds of pain and a little bit concept about the total pain. In the self-learning module, the majorly will focus on the pain pathway and the receptor and the ascending and the descending pain pathway, as they will be learning during their first year MBBS. Next, please. So our topic of discussion is a knowledge domain. Next slide, please. What we are planning is after the physiology sessions, before our session will start, we will start with the pre-session tests, where we'll be sharing with the Google document regarding 10 MCQs to assess their knowledge regarding pain and basic pain pathways, what they have already learned, followed by a teaching class. It will be a didactic of 90 minutes each, where we will be showing a role play model where the videos, we will divide the classes into 3 or 4 groups, and those case scenarios will begin with a simple case scenario, and to each group we will give one-on-one question. For example, what I thought is we'll start with a simple case scenario of a headache, where a working woman is coming to the doctor with a complaint of a headache, and she starts speaking, and she by herself is telling that I'm too stressed and all, I'm having so much sore headache. In the first scenario, the doctor is prescribing her a simple analgesics. And in the other scenario, when the patient is coming, the doctor is talking and asking about all the triggering factor, the emotional factor, and what are the other factors when the pain increases. So with this scenario, we'll stop here and ask the students. And in the first group, we can ask them, was the communication or was the patient managed well in the first or second? What are their thoughts? For the second group, we can ask the questions like, what else you could have thought would have been done? And that is how we're going to ask each group. After this discussion, we will again show a 5 or 10 minutes video where we will see the patient side story, where both the patients have received the same kind of medicine, but the first patient has not recovered well from the headache, whereas the second patient has recovered well from the headache. And after this 10 minutes or 5 minutes of patient side story, we'll bring in the concept of the total pain. Next slide, please. Then we will bring in the concept of total pain. As I've already discussed, I will share in the later slides that I have kind of uploaded few flyers from the Google that we will discuss, and we will show the importance. And all of this will be evaluated, as I've already mentioned, in the pre-session. There will be a Google document test. Followed by these sessions, we again will have a post-session test. There will be 10 or 12 MCQs, but this time additional we will be doing a case-based MCQs. They will give them a case and will see their responses. And this is how we are going to see for the assessment. One more thing I would like to add here was, I was thinking of we can tell the 1-1 group to make a poster, and we can just to make this concept more understanding, we will tell them to make a poster of what they have understood regarding the concept of the total pain. And accordingly, we can just distribute regarding the understanding and the concept, we can distribute prizes as well. Next slides. So these are the few flyers which we can share with the students during the class. Next. These are 2 or 3 slides. Next, please. Next. And this is just finally the total pain concept by the Saunders. Yeah. Thank you.
Thank you, Dr. Parul and Group 2. I'll wait for the comments from the faculty sometime. Anyone has any thoughts? Dr. Aditi, Biacin, Dr. Dinesh, ma'am.
The integration which they have mentioned, that's just technical thing. It is vertical in both cases. So even when you're integrating with medicine also, it is a vertical integration. It's not horizontal. Just that is a technical issue. Otherwise, it is quite good scenario.
I like the idea of posters because then the students will be involved. There is something to do. And I mean, they will at least try to understand. A few of them will be interested to create. So there's some activity involved. And yeah, that is very good idea to include, to evoke more interest. And they'll retain it more if they are involved in some activities, then they will retain it more later on. Yes, that's a very good idea. Thank you, Dr. Babu. Group 3.
Yeah,
Yes,
good
Dr.
afternoon.
Manish. Yes, Dr. Manish.
So our topic was to teach the pharmacology and the use of the drugs in particular pain management situations. Particular group of students will be the second year students. So they will be knowing the anatomy, physiology, and the biochemistry. So and also they are at the same time they are undergoing a pharmacology class. So what we can approach in this manner, we have 8-hour divisions and we have 8 topics, particularly on pharmacology of pain, pharmacology and the use of pharmacological agents in pain. So we can divide into 1 hour classes, and each hour we can divide as 20, 20, and 20 minutes. What I suggest here is in the first 20 minutes, we give a brief introduction of the particular group of drugs in first 4 lectures. One group will be NSAIDs, one group will be opioids, one group will be the anti-neuropathic agents, and one group for adjuvants. And in the first 4 hours, and within that particular 1 hour of a particular group of drugs, we can introduce the class of drug, the brief mechanism of action, and the basic pharmacokinetics and pharmacodynamics, because they are already knowing it in the pharmacology classes in their second year. And at the same time, because it's a 20-20-20-minute division, what I suggest, what we have come to a suggestion is that first 20 minutes we give a lecture. Next 20 minutes we discuss a case scenario where a particular NSAID has to be used in a particular group of patients. Like in a nociceptive pain, predominantly nociceptive pain, we're using an NSAIDs, and in predominant neuropathic pain, we are using that anti-neuropathic agent. And a kind of mixed pain, we use both of them. And in cancer pain, how are we using opioids? A particular group of patient having cancer. So these are second 20 minutes will be on particular case scenario. Next 20 minutes will be the assessment. We can say that, yeah, we have given you a brief idea of the particular group of drugs, their basic pharmacokinetics, the duration of action, the route of administration, the hepatotoxic effects, the nephrotoxic effects of particular group of drugs. And then we have discussed a particular case scenario. And now we give them a pre-test and a post-test of how you can approach the, how they have known that the knowledge and how we apply a group of drug in a particular case scenario. So here in this manner, in the first 4 hours, we give them the opportunity to learn about the group of drugs and their application in a particular case, and we test them at the same class where we know that how we have taught them better or not. So that's one way of giving the feedback per class. And after that, ma'am, the next 4 hours of that 8-hour topic, we have a non-pharmacological management of pain, where we can include the physiotherapy, the psychological counseling part, and the social aspect, socioeconomic aspect of pain. So, or the spiritual aspect, we can also include that in that 1 hour period. And also we can divide it into 20-minute intervals, and we make an interactive session. Here there is no particular group of drug involved, but again, their particular modality involved. So here we can ask them, in this particular situation, we have the patient having a psychological pain, or how we can approach them, what are the things to be asked and explored, so that we know and we can help relieve the particular psychological aspect of pain also. So after this, last 3 hours, we can focus on the difficult to treat patients, like in a patient of spinal cord compression where there is a neuropathic pain involved, or a particular brain tumor condition where we use different types of adjuvants also, like corticosteroids, opioids, and also metastatic bone pain, where we can use alendronic acids, the different adjuvants we use. So those difficult to treat patients we can discuss in the last 3 hours, where they will know the actual application of the medications in those group of patients. And in those last 3 hours, we can make it more interactive, like what will be your first line, what will be your second line, and the third line drugs. And also we can approach it in a WHO analgesic ladder manner, like we can approach it in patient to patient basis. And also we can give him the small hint of interventions, like the local anesthetics, the steroids, or the neurolytic agents, where we use in some cases. So those we can actually give them a brief idea, because those will be advanced procedures. Those we can give a brief idea, in particular difficult to treat patients. And this manner we can divide the 8-hour period in this 1 hour basis. First 4 hours for the drugs, next 4 hours for the case scenarios and discussions and difficult to treat pains. I'm open to suggestions from you.
Thank you, Dr. Manish. I think we have 2 pharmacologists here. We'll see how they are teaching this particular topic. I'm sure that's the most difficult topic, subject to teach without losing the attention from students, right? So I can ask Aditi and Biacin, both can pitch.
In our pharmacology classes, we have to teach them about basic NSAIDs, basic opioids. But I take those classes generally. All the drugs that are used in management of pain, I keep it for myself, because I want to touch upon the palliative care component also. And then I focus and bring case scenarios where pain management is the most important thing, like a palliative care patient, where all other curative aspects are not applicable. And then in such scenarios, this pain management is the most important thing that they need to do. And then in those case scenarios, I also, Dr. Rajgopal's, there was a news article in Times of India about the suicide conducted by parents because of not being able to tolerate the pain of their child. So this is my first slide that I generally present about the impact of pain, not only on the patient, but also on the families. And then we also incorporate in prescription writing. We have to, there is a lot of teaching on how to write prescriptions in pharmacology. So we have incorporated prescriptions on morphine, creating case scenarios where prescriptions on morphine, where morphine will be the drug. So they will write down 10 tablet morphine, 10 milligrams every 4 hourly, and 2 times at bedtime with tablet metoclopramide or haloperidol, and then Dulcolex or Bisacodyl tablets at night. And then we can ask them for conversion ratios also. A patient has to be shifted from morphine tablet to fentanyl because they cannot accept orally anymore. So conversions also we can teach them in prescription writing, and from immediate release to sustained release tablets, what will be the conversion formulas? If any 60 milligram morphine is being taken orally, then what will be the sustained release tablet? If 10 milligram oral is being taken immediate release, so the conversion will be 30 milligrams BD, sustained release preparation. Do not crush the tablets. So mainly we can focus more on conversions, and in prescription writing we can incorporate. That's my idea for teaching undergraduate students.
That's wonderful, because we get to hear from someone who actually teaches these topics. And I think Biacin was there in your group already, right? Dr. Biacin was there in your group?
Was there yesterday, ma'am?
No, I was there. I
Oh,
was
okay,
there.
okay.
I was
in group 4. Biacin ma'am is in group 4.
Okay, okay. Biacin, are you there? We would like to hear from you also, like how, is there anything else that you want to add? Pharmacology. I can't see her on the screen. Yeah. Let's see. So thank you so much, Aditi, for that. That's the conversion and things and making them write prescriptions might be a good idea than just sticking on to the theory. But I think Dr. Manish's presentation also had something on they are integrating the second half for case presentation, except the rotations, right? I mean the conversions that you have, I think you've covered. Thank you so much, Group 3, because this is a very first time they'll be hearing about morphine, and that will be there throughout their education. That's the first time that they should get the proper idea about opioids and not be scared when to use and how to use things. Wonderful. Thank you so much. Over to Group 4.
Yes, ma'am. I'm Dr. Uma here. I'll be
Yes, ma'am.
presenting on behalf of group 4, ma'am.
Sure, ma'am.
Just try to share my screen.
Okay. Ma'am, if you are unable to share, we can share from our side also. We have already shared it with us.
I think Shri ma'am, the topic given to us is assessment of pain and suffering. The lesson plan is for the second year medical students. The duration of class they've given is about 2.5 hours. The domain is knowledge, ethics, and communication. They should know and they should also show how. And here, the second year medical student already they would have known something about pain in the first year. They will know the anatomy, physiology. They would have just known about total pain, everything. And they come to second year, and here they'll be learning pathophysiology of pain, and they'll know about pharmacology. Slowly, this is the time they'll be entering into medicine, going to the OPDs and watching. So that is where is this activity classes come. Next slide, ma'am. So we are planning to take the class on 2 days. First day will be a large group teaching, wherein initially we start with just getting them to remember what they learned in their first year, 1 or 2 slides about total pain, what is the definition of pain, and then it's like a bridging. And then we go about the different assessment methods of pain and also about suffering. Something about suffering also we have to tell them about the cash tool and then the different assessment methods. And to make this didactic lecture interesting, probably we could use an online tool of Mentimeter. Tell the students to keep the phone with them, and then whenever we put a slide about one particular method, they could say it's good, or we don't understand it, or we understand this, we will use it, something like that. And then the students will be, then after 30 minutes, the students will be divided into small groups of, we are thinking 100 students in a large group. So 10 small groups of 10 each. So for 5 groups of students, there will be an activity given. We'll give them, you please discuss one particular method of pain assessment, say the visual analog scale or a FACES scale in children, something like that. And then each group will present the advantage and disadvantage of the method in points. All the other students also get to learn. And this will come to total of 15 minutes. Next slide, ma'am. And finally, we will summarize for 5 minutes. And on that day, we will give them something like a homework, like they will write the reflective writing about the perception of what is taught about assessment of pain and suffering, how the correct assessment will help in treatment, and then if they've had any particular experience in their life, that also they can write in the reflective writing part. Next slide, ma'am. So on day 2, it's going to be full of interactive sessions. The other 5 batch of students would be given a case scenario. And if we had time, we'll probably ask them to do a role play, or we'll show them a video. And they'll be asked to assess whatever scenario comes there. For one patient comes and he's talking about his pain, we'll ask them what method you will be using. You assess. And then they will write their comments. Then the whole thing will be debriefing done for 10 minutes. And at the end of all this, we'll play a video to show them how pain assessment done correctly in 10 minutes, like how to talk to the patient. There are a lot of, we will just talk about in the didactic lecture about different assessment methods, but when you're seeing and talking to a patient, how your body language should be, how to learn from his body language, all the other points will be learned here. And totally we summarize this again for 5 minutes. Next slide, ma'am. And how will we assess the students, whether they've learned correctly? And initially, there will be a pre-test and post-test. We are planning for a pre-test, either MCQ pattern or a true or false pattern, to know what little or what more they know about assessment. And then there will be a post-test on day 2. And we'll also give them a scenario, and we are asking them on the day 2 about after the scenario, they're going to write and discuss. So that's going to be how we are going to assess their shows out pattern. Thank you, ma'am. That's it.
Thank you, Dr. Uma. I think in the initial part, there were a lot of activities involved. So that will keep the students engaged, like learn about each scale, go into small groups and discuss about it, and then come back. Then it's a good thing that you're starting with the recap. That's very important, just to give the background and then take them from there, and summarizing in the end. I think that's very important. I'll wait to hear from the faculty members or other participants for any comments for group 4. In the folders we have shared, there is a folder named Epic Videos, which has a video on pain assessment, where a doctor is assessing pain and how he's marking the body chart. Yes, how she's asking questions beyond the physical pain. So maybe we can use those that video. Yes, ma'am. Time permits.
Sure, ma'am.
Any other comments?
Madam, this time frame which was given, strictly it has to be adhered to that time, or we can take some more time, madam, because the students, strictly though we tell in minutes, we may not be able to complete. So for their understanding, can we extend the time also?
I think I'm not the expert in answering that question. There are people from medical colleges here. Can we actually overshoot the time? I'm not sure. The practical difficulties, I really don't know.
I am asking is all this we are okay. We are putting like a list. But practically when we take the class, sometimes we may not be, really we want the students to understand, it takes some more time.
Ma'am, we are given a specific time and we have to stick to that, because after 1 hour, another faculty would have been allotted another topic which has to be covered.
Yes.
So it has to be strictly within that time period.
Madam, what can be done is maybe we can record a lecture video. There is a app called Screen Recorder. We can switch it on and record our lecture video and share the link with the students freehand, and they can watch and come. That will save some time in our actual session, and they can watch later also.
Yes, ma'am. That makes it interesting also for them. Otherwise, actually saying we are saying didactic lecture, more than 15-20 minutes to retain their concentration becomes little difficult. Personally, I have felt it. I'm an anesthesiologist and a pain physician. We go take classes to get their concentration, or for them to understand, we have to use different methods. As sir said, we can share the video with them, tell them, read up on this pain assessment and come tomorrow, you're going to do a role play, something like that, and they are interested. They will come and do it. That's how we try to manage the classes within the time given, ma'am. That's what at least we do.
That's very interesting. Maybe some movie clips where you can relate or start the conversation from and send it across. They'll just watch the video and come back. Yeah, that's that flipped classroom method is something that can save time. If it is reading a document, then probably none of them are going to read. If it is a video, then there is a high chance that they'll actually watch and come back.
Or we can also give them assignments to be done from home.
Yeah, for the actual session, we need to stick to the time.
Yes.
But if you like, you can supplement it with some extra material before, after, or some links. That all we can do. But as ma'am told, we need to stick to time because other people will be in line. No? So you have to imagine like what happens if you are waiting there and your preceding faculty has not finished. So you don't want to land in that traffic. In fact, you should target to finish, let's say, around 10 minutes before the planned time. So you can address certain queries also. You have to cut down on the content, madam. That's the only option. Thank you.
Thank you, sir.
Thank you, everyone. Yeah, I think always keep 10 minutes in the end so that if they want to ask questions and students, like recently, Dr. Rajgopal was talking to the medical students in SRM, and the questions that they were asking, like I have not seen the senior doctors asking such questions, like how do you manage suffering within yourself when you're seeing this suffering every day? So given the 10 minutes, they were so interactive, they were coming up with a lot of questions. So always keep that last 10 minutes, what if they want to ask important questions. Thank you, Dr. Uma, for the wonderful plan. Thank you for all your group members and the mentor.
Thank you,
And-
members, and thank you, Biacin ma'am, for mentoring us.
So over to the last group, group 5.
Yes. Hello, everyone. I'm Dr. Priyanka. I'll be presenting on the behalf of Group 5. Ma'am, may I please request Shreedevi ma'am to
Yes,
share the
yes,
slides?
we'll share it.
Okay. So, ma'am, can I have the first slide, please? So the module that we were given to be talking about today was application of pain relief to suit the individual patient needs. Next slide, please. So there's a SMART criteria for the learning objectives, and we want to go about that to formulate the objectives for this session. So the SMART criteria is basically, the first one is S, that is specific. Now what we need to do is we want to specifically state a goal. So for example, for this session, the clear goal would be application of pain relief to suit the individual patient needs. The next one is M. That means the M criteria means measurable. So the goal that we have put forward for ourselves should have a measurable outcome. For example, we need to have certain assessment tools by which we can evaluate by the end of the session that how successful it was. Another criteria comes A, which is attainable or achievable. So we do not need to overwhelm ourselves with unrealistic goals. We should keep our goals simple and achievable, or otherwise, of course, they might end up into failures or insufficient or inadequate. The next one is R, which is relevant. Now we need to understand that whatever goals we are putting forward for the students' learning perspective, they should be relevant to them, to their state, to their knowledge that they are already having, and the education that they are receiving. For example, for this particular session, we need to focus particularly on the identification of different domains of pain and the appropriate multimodal management. That is only the point of focus here. We should not try to go astray or haywire, otherwise we'll lose the whole essence of that session. The next is T, which means time-based. That is, we need to time-bound goals. For example, for this particular session, as per the module given by Palio, the time was 2 hours duration for the session on this particular module. Next slide, please. Students for this session are third or fourth year MBBS students. It was given differently in the module, so we have included both the years. Now the domain that we will be discussing is knowledge and attitude. So students are expected to know how, to know first of all, and then to know how. The session delivery time has been kept as 2 hours. To coming up the objectives of this session that we need to achieve. So to name them, firstly, it will be to evaluate the patient. We want our students to evaluate a patient who is suffering from pain, identify the different domains of pain. Now, as we all know, physical pain is something which I think everyone has seen a lot, and everyone can obviously identify. Second, management of pain using multimodal approaches to cater to the specific aspect of pain. And the third one would be to identify the factors which are modifying the pain, because there can be certain correctable or incorrectable factors. Now, the students need to identify if there is a correctable factor and help it reversing or correcting it. Next slide, please. So having said that, how we want a session to progress, we'll be dividing the session into 4 subsections. The section 1 would be basically a revisit of what they've already learned. Now we know that these students are the ones who are currently studying in 3rd or 4th year MBBS. So they have a basic idea of pain. So we will just take a recap of what is pain, what are the different types of pain, how to evaluate pain, what are the different tools, and finally the management part. Now we can give this section nearly 10 minutes duration amongst the 2 hours that is totally your time. And this we can achieve by maybe using certain PPTs, certain audio visual displays or educational videos, and also an interactive session with them. Next slide, please. So next we come up to the second part of this session. So we can keep a duration of 15 minutes for this session. And what we are going to do in this one is have a case-based discussion and a didactic lecture to actually enhance and to reinforce the idea of total pain in their young minds. What is important is for them to identify, inculcate, and resume the idea that there is something called total pain and not just a physical pain, not just an emotional pain. So maybe we can focus in this part for them to identify the different issues of pain. For example, if we give maybe a story to them, like there's a patient with squamous cell carcinoma lung, which is metastasized, and the patient is presenting with ascites, or maybe nerve palsy or direct pain. Now, this would be something which is a directly disease-related issue. There can be other issues as well. For example, treatment-related issues. Maybe the patient is having tracheostomy, which is blocked, or he doesn't know how to go about the tracheostomy care. The RT-related issues, that is Ralph's tube-related issues, etc. Then moving on, the patient can have other comorbidities as well, which need to be taken care of. For example, he's uncontrolled diabetic, or he's having coexisting anemia. Other is certain debility, which is basically cropping up because of these issues, like fatigue, weakness, repeated superadded infections, etc. And of course, the most important ones, the various psychosocial issues, the financial issues, the emotional components, and the personal interrelationships. So all these need to be basically focused upon. Next slide, please. Having said about this, that the focus should be on identification, next component becomes how to employ different approaches to manage these aspects of pain. So as already has been discussed in the previous groups, by the previous groups, they can be non-pharmacological, pharmacological, psychological, and other interventions, etc. Next slide, please. So next would be the third part of our session, and this would be a brainstorming section. So we would like to give the major portion of our time to this one. That would be 75 minutes out of the 2-hour duration. So in this, what all we can do, firstly, we can have small group discussions. For example, if there's a batch of 100 students, we can maybe form 5 groups each and just render them a story of a middle-aged man who is diagnosed with a life-limiting illness. For example, he had a stroke and he has now the sequelae of paraplegia. Now we'll ask the students to identify and reflect on how the total pain has impacted the person. What are the different activity limitations that he might be having, the financial, emotional, social, and personal issues he might be having. This is something for the intra-group discussion. Then, of course, there can be a large group, inter-group discussion. In this, having said what are the issues, they'll go on with what are the different needs now the patient needs to be taken care of, and how can we actually allay his pain in these particular domains? What can be done about that? Another way can be role play, in which, of course, there can be a group of students who can come up, play their relatable scenario, and amongst the audience, they can just jot down what they feel like are the issues that are apparent and what they can do for that particular scenario of the particular domains of pain that the patient is experiencing, or if they feel something else could have been done better. So they can be that session. Next slide, please. Again, there is a component of bedside demonstrations. Now, bedside demonstrations can be for both the demonstration of knowledge and attitude, as well as some basic skill if need be. For example, a specialist can on the bedside emphasize how to identify the pain domains and formulate the specific management plan. Maybe he can demonstrate certain simple procedures as was discussed earlier. Now, more important than that, what was actually discussed in our small group discussion earlier, very rightly, rather than this role play or bedside demonstration, what could be even better is if the students could be actually taken to a hospice ward or a palliative care ward where they can interact with the real life patients, basically, who can, if consenting, who can just narrate to them their experience, how they felt about it, how it started, and how they are feeling right now. Because of course, as we all know, real life experiences are far more impressionable than classroom lectures. So if feasible, that can be done. Apart from that, like there's another very good idea, like the family adoption programs that is being done in the community center, in the community medicine, department. Like since first year, they are given some family. Now, as the students are going over and interacting with the family, so in that case, they can actually interact with the patients, maybe some old, some grandpa in the family. They can interact with them and actually ask about their experiences, give their opinions, and maybe come back and ask us as the mentors or the teachers, like how to go about this. That could be even more, I think, beneficial. Next slide, please. So we come up to the final section of our session, which is assessment. And yes, I would just like to say another thing, as was told in the previous session, that we can also keep a query and answer round, which can be for maybe 5 or 10 minutes in this third section, so that they can actually come up with what they feel or what they have queries about, or their confusions and all. Now, progressing to the assessment part. So it can be a formative evaluation in which we can, as the students already have an idea about pain and the different concepts of pain, so we can have a pre and post test questionnaire, and we can evaluate how much our teaching has improved or benefited them. Next, we can go with having certain MCQs or short notes on different aspects of pain and the management. Some long essays can be given. There can be some in-class quiz that can be held. And again, a summative assessment maybe would go a long way, because mentor very rightly that the institutes or managements are also the teachings are a part of assessment. And of course, from the student part too, if they know that this is something which is going to be involved in the final assessment, they would be perhaps more concerned about it. They will try a little more. And this must be one of the stepping stones to start, to give them that push towards learning about pain and invoking their interest in the long run. I think that's all from my side. Thank you.
Thank you, Dr. Priyanka. I just wanted to mention that there is, in one of the modules, we have given certain prescriptions that I think during the pharmacology session, maybe you can give it as an activity for the other group, correct the prescription. So if you don't get time to engage in a role plays or something where you have to spend a lot of time to come back and debrief, you can always give them mixed prescription, right and wrong prescription, and we can tell them, okay, what was wrong, and write the correct prescription then. So that's one way that this group can also think. So there is a PowerPoint in that modules that we shared, where is prescription correction, it is written. And for everyone who have been explaining about the case-based discussion, all these experts have come up with a lot of case-based scenarios, depending on the year which they are in, depending on the level of understanding. You please feel free to use those case scenarios, because you don't have to waste time again to prepare a case scenario and go. You can just use it, just go through it. Instructions are also being given. What all questions can be asked is also given in those documents. So kindly make use of those resources created by experts. Any comment from the faculty members? Dr. Dinesh, there was a question that whether during the internal medicine posting, whether the pharmacology people can, is that possible to integrate that way? Like pharmacology people can also pitch in, or the basic science people can come in during the internal medicine? Does that come under the vertical integration?
Yeah. So it's not during the usually practical posting. It is usually during the theoretical training that happens. So the pre-paraclinical faculty can also join those sessions. In fact, it is encouraged also.
Thank you. They asked the question during the discussion.
Yeah, that is encouraged.
Thank you.
Only thing is difficult
yes.
to find clinicians who will ask them to come there. Usually it is the other way around. When we have sessions in pre-para, usually people from clinical branches come down. Other way, usually it doesn't happen, but once in a while, they can try that also. Especially if they are talking about this morphine prescription and all, clinicians will be very happy to get pharmacology people to be there.
Thank you so much. Any last closing comments from any of the faculty before we wind up today's session? If there aren't any, we can wind up today's session, but I expect more interaction from the other group participants. Once your group is done, then you are all silent. Please feel free to give your comments to the other groups. So that's, I think we can, I hope we'll see that in tomorrow's session. Like, please feel free to pitch in and give your ideas. Sometimes you just are kind of restricting yourself to your own group. That doesn't happen when you go out for teaching. There are no groups there. So please feel free to interact more for the other groups also. Thank you so much for all the faculty members for joining us again for today's session, and all the groups who are actively discussing that. And today they were all ready with the presentations and a plan. That feels exciting and wonderful. Thank you so much, everyone. We'll see you. The last day will be tomorrow with sessions on end of life care, various aspects of death and dying. So we'll see you tomorrow at the same time. Thank you so much, all the faculty members.
Thank you everyone for joining in, and please do join us tomorrow, same time, for the last session of our faculty development program. Till the time we meet tomorrow, this is Sri Priya along with Dr. Sreedevi, Warrior, and all the eminent faculty. Same data. Take care, everyone.